Now, assessing an airway. We're not going to talk about Mallampati's today. Some people talk about Mallampati's as perhaps able to contribute to predicting a difficult airway. Some people say sensitivity is 60%. It's probably more likely to predict the difficult BVM or bagging the patient, how problematic it will be or easier it is going to be to bag a patient within after you've paralyzed the patient and you need to bag them for rescue oxygenation. Most likely it's going to predict an airway obstruction causing or leading toward difficult bagging BVM. All right, that's from Weingart, who suggests it, and it really makes sense. I don't do Mallampati's patients who are cursing at me, spitting at me, potential head injuries, having seizures, on the back on a backboard, hypotensive, unresponsive. You can't do Mallampati's on your back. You don't do a Mallampati's with your with the trunk depressor. Okay, it's usually by a relaxed person who cooperates. All right, the person who's apneic or hypoxic or close to respiratory failure, I don't think they're going to be actually keeping their mouth open for you to do that assessment or to be cooperative. And if they could, great, nice to document. But what I really care about now is what is the person who I'm intubating with having them tell me what they see. Okay, if they see the cords, if they see posterior cartilage or retinoids. Okay, the issue is not everyone talks like an anesthesiologist. Cormack-Lehane classification scores. Okay, ideally this would be like a Cormack 1. Look at all these vocal cords. It's so great you can see the tubercle underneath. It's a little nub that hangs underneath the epiglottis. So this is the underbelly of the epiglottis. This is great exposure. All right, Cormack 1. Cormack 2, getting obstructed. Cormack 3, you barely see a sliver of the cords. All right, at Cormack 4, you only see tongue. There are arguments about the grades of Cormac's, and never be the second person named after anything, because almost everyone remembers Cormack and not Cormack-Lehane. It's Cormack/Lehane scoring system. All right. Dr. Levitan suggests something simpler. Right. I see 100% percentage of glottic opening. I see 100%. Or I see 75% of it. Or I see half of it. Or I see 25% of it. I see Alea retinoids. Or I see nothing at all. And that would be comparable to your Cormack-Lehane score 4, grade 4. Pogo kind of makes sense. It may have a cheesy name, Pogo, but it kind of makes sense better. It makes more sense to me to say percentage of glottic opening. How much do you see? Okay? If there's a hot dog hanging out from the vocal cords, it's nice to know. Right? I know none of you guys have such great vision. You see carina from here. You may see a glint or a hint of tracheal rings if you have a good light source. Okay? You tell me the percentage of glottic opening, me and you will get along. If there's long silence, every time I ask you this, someone's about to lose their opportunity to intubate this patient. Somebody I know and very close to. Right? If I go from the foot of the bed and I disappear and you don't see me anymore when you take a glance up, it's because I'm right next to you because you've not answered the appropriate answer. Tell me you don't see anything or see something. But don't lie to me. I don't want silence. That silence causes doubt. And doubt leads to mistrust. At least in airway. And a lot of aspects in life. Thank you. Hope you come back for more video education by Torres.